So we are going to have a wonderful presentation now by Dr. Noam Rudich. Every dog needs a safe place where he can be afraid, integrating insights from human and animal trauma studies. And this is the wonderful way Noam is presenting herself. I am Noam. I am a therapist. I am an animal rehabilitator, and I live among them. For the past decade, this has been my life. My morning conversation with Brile, my deaf dog, and Vicky, the duck, are my anchors. The true sense of home that drives me is the experience of being part of a real pack, a community of animals and humans together. This is my engine. I believe in a world where no one has to fight for their basic rights, where every woman, every dog, every duck has the simple fundamental right to be exactly who they are. Day by day, I weave the threads of our stories, mine, the animals, and my patients, into a single shared story of human and animals. A story where we don't stand at the disposal of one another, but simply stand beside each other. I'm pleased and honored to invite Noam.
Thank you, Sarit. Do you see my presentation?
Yes. Yes.
Okay. Gal, I still have tears in my eyes following your talk. Try to focus. But thank you for your talk. So, good morning or good afternoon. My name is Noam. I'm a psychotherapist. I'm an animal-assisted therapist, and I hold a PhD in medical sciences. 10 years ago, I founded Chimes, a unique therapeutic space that serves both as treatment center for children, youth, and women dealing with complex trauma, and as a shelter for animals. It's a space where the human story and the animal story meet, creating a new relational alternative for all parties involved. The title of my presentation, Every Dog Needs a Safe Place Where He Can Be Afraid, is a quote that is very dear to my heart. It was said by one of my patients during a session where my dog Brile was feeling very afraid. She said that she was happy that Brile finally had a place that was safe enough for him to be afraid in. Today, I want to talk about these connections between the human and the animal trauma worlds and how this mutual recognition can serve as a powerful engine for healing and for rehabilitation for everyone in the room. To navigate this interspecies meeting, I use 4 theoretical pillars. The bioresonance, which looks at our shared biology, and thank you, Shlomit, for mentioning it yesterday. The interspecies field based on Bayes' group theory. The relational intersubjectivity, where the animal is a subject. And the reciprocal healing, the final repair of mutual dignity. When we examine how traumatic events affect us, we see a clear and striking similarity between humans and other social mammals. And again, Shlomit and Lauren mentioned it, so it's not new for you. Trauma isn't just a physiological story, it's a physiological event. Whether it's human or a dog, the hormonal response is virtually identical. The same surge of adrenaline and cortisol through the HPA axis. Physiologically, we see the same freeze, flight, or flight responses and the same impact of heart rate and the nervous system. Even our cognitive and emotional reactions mirror one another. In both species, trauma shifts the brain from thinking mode to the survival mode. We see the same hypervigilance, the same emotional withdrawal, and the same sensory-bound memories. This leads us to crucial understanding of this conference. Trauma is a shared mammalian language. When we treat a traumatized human with the presence of traumatized animal, we are working with 2 nervous systems that speak the same biological dialect. Sorry. So understand how we heal, we must first understand the window of tolerance. The window of tolerance is the zone where we function most effectively. When we're within the window, we can process emotions, learn new things, and manage the challenges of daily life. However, when we are pushed outside the window, we enter two extreme states. The hyperarousal, which is above the window, this is the fight or flight zone. It's characterized by anxiety, panic, anger, and a racing heart. We're overwhelmed and overstimulated. The hypoarousal below the window, this is the free zone. It leads to emotional numbness, exhaustion, feeling spaced out or disconnected from our bodies. In other words, dissociation. What is the most critical to understand is that trauma significantly narrows this window. So for someone who has experienced trauma, whether they're human or an animal, the space where they feel safe and regulated becomes very small. Even a minor stressor can instantly kick them into the state of panic or complete shutdown. In our work, we see this clearly. Trauma doesn't discriminate. Both humans and animals carry this narrow window. Our goal is a shared therapeutic space that is slowly and safely expand this window together, creating a larger safe zone for both species to exist in. So let's take a moment to look at the emotional space created by the window of tolerance and the shared trauma response I mentioned earlier, and also Shlomit and Lauren mentioned. On the left, living outside the window. This is what happens to both humans and animals when they are outside the window of tolerance. In this zone, there is no sense of safety. Emotional defense mechanisms are activated to protect us from mutual connection because the core nature of the relationship is perceived by attacker versus victim, or what Gal mentioned, the doer at dantu. In this state, true partnership is impossible because the system is focused solely on survival. On the right, our goal and aspiration. This is where we strive to be. Our goal is to shift from a relationship of attacker-victim to one of mutual recognition. In this space, both participants are within the window of tolerance, allowing co-regulation. And here I have to thank Barbara for mentioning the co-regulation yesterday. So the obvious question arises, why bring together a person struggling with post-trauma and an animal facing similar challenge within the same therapeutic space? I will address it from a moral perspective, following by theoretical foundations. First, on a practical level, we all have the potential to raise or rehabilitate animals with traumatic history when we choose to adopt or rescue them. Second, this approach stands as an ideological opposition to the commercial trade of animals. Third, it stems from a wide open heart, a commitment to welcome both patients and animals who carry profound struggles. But most importantly, I believe in fostering a profound non-verbal partnership between human and animal. If done correctly, this creates a unique window of opportunity for healing for both the two-legged and the four-legged patient. But what exactly is done correctly? By creating a partnership, place for non-verbal understanding for the gaze of transference, the human and the animal, and opening a new opportunity for attachment. Now that we have recognized the striking similarities in trauma responses between human and animals and seen the potential in weaving our stories together, let's look deeper into the dynamic of the connection. This partnership is powerful, but it's also complex. We must look at both the shadow and the light. And I will begin with the shadow. The shadow is the risk. In a field where trauma is present, we often see reenactment. This is when the trauma isn't just talked about, but it's actually relived through the bodies in the room. If the patient is flooded with terror, the animal might sense it and react by its own survival behavior, perhaps hiding, barking, or becoming restless, and vice versa. This creates a dangerous loop. The animal's distress then feeds back into the patient's fear and vice versa. So acknowledging this dysregulation, saying, for example, look, I think we all just felt the air gets very heavy and scary in here, is the first step to breaking the reenactment and moving back towards safety. If you create a relationship that is unpredictable, power-based, or unsafe for either the patient or the animal, we're not healing. We're just repeating the injury. And this is the light side of co-regulation. The healthy path is like this. On the other hand, when guided correctly, these connections create a unique healing resonance. It's the healthy bond that promotes the well-being of all parties involved. Here we are moving from the self-regulation toward reciprocal regulation. The shift we are looking for is the move from I to we, as Gal mentioned before. When we talk about co-regulation, we're talking about two or more nervous systems in the constant, non-verbal dialogue. If there is no co-regulation in the room, everyone is forced to regulate themselves in isolation. But when co-regulation is present, it becomes a shared resource. So now that both pitfalls and the potential for hope in trauma therapy are clear, I will focus on the theoretical framework that enables this reciprocal approach. I would like to anchor our discussion in two pivotal theoretical perspectives that allow us to rethink the therapeutic space. First, we look at on the work of the Beranger couple and their concept of analytic field. The Beranger shifted our focus away from the individual to the shared unconscious field that is created between the patients and the therapist, to the psychology of the dyad. In this field, emotions, fantasies, and traumas are not just communicated, they are lived and transformed within the shared matrix. This perspective is crucial because it allows us to include the animal not as a subject, but as an integral part of the living field, including its narrative and transference. Bion viewed this occurrence within a group as a dynamic field, and I would like to propose that a similar dynamic exists within the interspecies encounter. So the two theoretical perspectives I've presented, the group therapy and the group relations and the field theory, suggest that the connection between human and animals, spanning both conscious and unconscious levels, co-created a unified field. By attending to this shared field, we open up a therapeutic process that holds and transforms the experience of everyone involved, both two-legged and four-legged. The practical implications for trauma work become much clearer. It makes a fundamental shift, moving away from the working directly at the patient toward observing the field that is being co-created. So we have covered a lot of theory, and now I want us to move from the why to the how, into the actual therapeutic practice. But just before I show you how it looks in the room, I want to clarify two important points. First, when we work on complex trauma, we are always balancing two things. We need grounding techniques to regulate symptoms, but we also need to dive into dynamic themes of trauma. And the second one, and most importantly, is the ethics of this session. Every example I'm about to show you is based on one thing, the animals and the patient's free will. The dogs are partners who choose to be there. I constantly monitor the behavioral cues to ensure they feel safe enough to either engage or step back. I choose to work specifically with dogs because they are social beings who actually seek and benefit from human connection. To me, this is crucial. If the animal doesn't have a genuine need for this bond, then most of the mutual healing I've talked about today simply wouldn't apply. So staying with the realm of the interspecies field, I will now present few clinical examples that illustrate few concepts in action. The first case focuses on the word of grounding, and from there I'm going to move toward toward examples of dynamic therapeutic themes. So I want to share the story of B. B is a survivor of sexual abuse and coping with complex trauma. B frequently struggles with overwhelming flashbacks that collapse her sense of time and safety. During one particular intense session, as B was being pulled in a terrifying flashback, my dog Hope, I will say to the Hebrew speakers, Hope is how I translated the name Sasson, because Sasson is something like joy, but joy seems for me a bit objectification of her mood, so she's Hope here. So Hope did something pivotal. Without any command from me, Hope chose to leave her spot and move toward B, pressing her body against her. So B was asking me, following this flashback, was she with me the whole time? And I said, she chose to be with you. I think she sensed how much you were suffering. And you didn't make her stay? No, she wanted to be with you. Hope wants to be with you, even when things are really bad. Yes, she is moving with you from your past into the present. No, she is bringing me from the past into the present. The truly grounding element here is that the knowledge that Hope chose to witness this pain. Had this witnessing been forced upon her, the therapeutic space would have collapsed, regressing into a space of power, mirroring the very word trauma we're trying to heal. Hope, a dog who is herself a trauma survivor, now chooses to be present with others in their suffering. In doing so, she reclaims her own agency to the capacity to make independent choices. And from here, I'm going to move to another example, starting with trust, that was mentioned earlier today, and really is the big challenge of working with trauma survivors. So for me, working on trust is the hardest and one of the most central labor in trauma work. To establish trust with the survivor, we must first demonstrate trust ourselves. Trust in the patient's unseen mental pain, and just as importantly, trust in animal patients. So according to the field theory we've discussed, trust is not a static state, but is a dynamic multidirectional flow. It must exist within ourselves, between us and our patient, and fundamentally between us and our animals. But how does an animal experience trust? It's not just being in a safe place. In this shared field, animals feel trust when they sense they have our permission to experience and express the full range of emotions and behaviors that arise within them, both in response to us and to our patients. When we respect their authentic reactions, we validate their subjectivity, and in turn, we create a truly safe field for everyone. In this case, a new patient arrived at my clinic. I didn't know her history deeply yet. However, my dog Kim reacted immediately. Yesterday I was in the ER. This is what my patient said. Yesterday I was in the ER and today I'm here. It's really hard for me. Kim, who usually lies quietly during sessions, becomes restless and gets up, moving toward the patient. What is this? What is happening to her? I am not sure myself. This isn't typical for her. Something is making her uncomfortable right now. Do you have any idea what she might be feeling? Meanwhile, Kim begins to bark at the patient, which is very unusual for her. I try to see what might help her without dismissing her feelings despite the discomfort in this room. It's something from her past. I agree, it doesn't feel like something from the present. She's sensing the past right now. On the streets, where she came from, there were scary things. What could frighten her? The drugs I took yesterday. Kim is a rescue dog who underwent a long process of rehabilitation with me. Kim began to bark in a way that was unusual for her. Instead of silencing her or treating her bark as a disturbance, I trusted her. I trusted that she was sensing something unspoken in this field. By validating Kim's distress, saying to the patient, Kim is sensing something very heavy right now, we opened the door. The patient, who was disconnected from her own feelings, suddenly felt seen. She realized that she could trust and respect Kim's pain, and I could be trusted with hers. This is the core of the model. Kim's ability to react was a result of her own healing. Her rehabilitation allowed her to become an active participant, and my trust in her allowed the patient to begin trusting me. We don't just use the dog, we rely on our partners whose own recovery makes our clinical work possible. So let's move to the next example and another dynamic theme. I'm going to give you an example on another theme, which is attachment patterns, specifically how they manifest as a profound defense mechanism in the wake of trauma. So this patient struggles with deep, long-term avoidant attachment. For a long time, she maintained a rigid emotion distance, effectively bypassing the real connection with me and the therapist. And her history had taught her a painful lesson, that people are inherently unsafe and that isolation is the only reliable form of protection. Lev, which is the Hebrew word for heart in English, so I will call him Lev here, came from a very difficult background. For months after I adopted him, he was completely avoidant, shunning any form of contact. Only when he finally felt safe enough to make that risk did he reveal himself as an incredibly communicative dog, possessing dozens of nuanced facial expressions and body gestures, and a moving ability to actively seek out connection. I feel like it's a real effort for you to be here. This is what I said to my patient, to ask and receive help. I really don't want to be here. I even told my parents I don't want the help. I sense that you are dealing with some very difficult things. It's hard to face them alone. That's true, but I don't want to deal with what happened in the past, and I don't want help. And yet we're here together. Because you have a trick, Lev. I don't want therapy, but I am attached to him. He understands. Lev rests his head on her, and she begins to cry. So, when Lev sat by these avoidant patients, it was a meeting of two survivors who both knew the heavy cost of isolation. His ability to wait for her without demanding or intruding came from his own lived experience of moving from fear to trust. This wasn't just a dog sitting in a room. It was a profound, silent dialogue between two souls who spoke the same language of survival. Critically, Lev didn't demand anything. He didn't push against her defenses. By simply offering his unconditional and non-intrusive presence, he began to soften the field, allowing a new kind of attachment to slowly take root where words had failed. And for the last example, in this final clinical example, We address one of the most complex layers of our work, traumatic memories. Let us all remember, trauma is not stored in words, but in the body. And this is true for both humans and animals. E sought trauma treatment despite having no childhood memories whatsoever. There was no thread to follow, no narrative of her past, and no clear picture of the emotional climate in which she was raised. However, during the recent war in Israel, the defensive walls of the silent began to crumble. I am starting to remember things that happened. She shifted restlessly in her chair. Lev, too, appeared uncomfortable in his armchair. He begins to bark and chooses to approach the clinic door. Lev is sensing something. So I say to him, "You can choose to leave, it's okay." It's hard for him to be with me right now. Maybe it's hard for him with some parts of you that are coming up now. Or maybe with parts of himself that he is feeling at the moment. They really are unbearable, even for me. In the interspecies field, where we often witness what I call somatic echoing. A patient may be struggling with a fragmented sensory memory, a smell, a sound, or a physical sensation from their past. And at the same moment, we see an animal react as a similar internal trigger. Because animals, like humans, carry their own history of pain, the room becomes a space where two sets of traumatic memories meet. As we conclude, I would like to synthesize our journey into three core pillars that define the interspecies therapeutic paradigm. First, the foundation, the bioresonance and the field theory. The concept here is simply yet profound. Trauma is a shared mammalian language. We are not just two separate entities. We are within a bionical container where both human and animals might feel safe and regulated. The clinical insight I want you to take home is that stabilization is not just a pre-therapy, it's the therapy. The act of establishing co-regulation is a shared field is itself the beginning of the traumatic repair. The encounter, relational intersubjectivity. This pillar demands a shift in our perspective, moving from seeing the animal as a tool to recognizing the animals as a subject. By establishing what Ogden called the relational third, we create a space that bypassing the patient's intellectual defenses and allows for new attachment patterns to form. The clinical insight here is crucial. When we recognize the animal's agency, the right to choose to stay or to leave, we are directly modeling the patient's own path to self-protection and dignity. And the repair is the reciprocal healing and ethical growth. Finally reach the level of the repair itself. We heal from the trauma of objectification through the active practice of non-objectification. We move from treating a victim to engaging in mutual relationship. We integrate our fragmented, traumatized parts by witnessing and respecting the other. In this model, healing is a shared unconscious project. As the animal finds its voice for safety, the human finds the courage to reclaim their own. And this is what I answered my patient who told me about Braille. She said every dog needs a safe place where he can be afraid. And this is what I told her. When we allow his fear to be present, we also allow your pain to be seen. And maybe in time, we will find that fear is only one part of a much larger story. Thank you very much.